always listening to Tony, and I agree with what he says about the bureaucracy. Some of the NHS bosses have been paid immense salaries, whereas the nurses have been left behind. And you remember that edition of Yes Minister, when they built a new hospital, and they didn't have any patients in there because they couldn't afford to get any patients in there because, of course, the management was using up all the money. Clearly, as absurd that is, the vast majority of people do get good service in the National Health Service. I know that the nurses work valiantly to provide that care. It's not always brilliant, and I know that from the number of people who come to see me at my surgeries relating experiences whereby I'm afraid people are not properly looked after, that people, for instance, that food is put in front of them and they haven't eaten it and it's just taken away from them and nobody's actually notified that they haven't eaten the food. I mean, these are actually cases that have been brought to me, and that has got to be sorted out. And as many of you will know, sadly, my mother died last year of a superbug contracted in one of the hospitals in Wales. And clearly there has been a huge problem with that, and you think in the 21st century we shouldn't have that particular problem in our hospitals. So I think that we've got to look at how that money is spent, how the management is done, to prune back the management and ensure that the money goes through to frontline services. I don't want to receive another letter or speak to somebody who tells me that they've got cancer and they've been told that they can't get a drug that will prolong their lives simply because NICE says that they can't have it, when that same drug is available in Scotland or Wales. That's appalling. And of course you will all know through the Barnett formula that your taxes are going into Scotland and Wales, which means more money is spent per head of the population there than is spent in England. That should not be allowed. We've got a National Health Service, and it should be done equally for the whole of the country, irrespective of the devolution settlement. So I want to see far more investment done equally so that none of our people suffer, as is the case. Also, the elderly has been mentioned as well, and I believe that the vast majority of elderly people want to stay in their own homes and be cared for as long as it's possible. They don't want to move into institutions where they've got loving people who are around them that care for them, which happens in the vast majority of cases. Unsung heroes. And I'm so grateful for organisations like Crossroads, or Crossroads Cares, they've renamed themselves. I was at one of their charity fundraisers on Wednesday, and it's an amazing job that they do in ensuring that there is support for the carers, the people who actually care for people who are in long term. And if it wasn't for them giving respite care for the carers, then you'd find a lot more people were not being cared for at home, and indeed a lot of other people would be going ill themselves. We've got to make sure that we do a lot more and support a lot of these other organisations that are out there caring for the elderly. And as you know, one of our policies is to bring forward an insurance policy whereby people would be able to contribute £8,000 and would not risk, if they go into nursing care or a retirement home, that they would lose their own homes, which they've invested in for their family to pass down the generations, to see it actually sold off and that money drained away until it was left, until a small amount was left before then they were on the state. I know there's a lot of people out there who say a lot of people who've not put away for a rainy day, who are looked after, and that those who have are not. That's not the fair society that I want to see.
Thank you. Alan?
As I said, I'm a local councillor.